Hello, and welcome to a webinar from Nextgen Healthcare. The name of the webinar is One and Done. The question we will address is it time to consolidate your health IT platform? This webinar is part of a series focused on the future of health IT. My name is Angela Avila. I'll be your host for this session. If you have questions, I'd like to invite you to please submit them through our Q&A box. All questions submitted for presenters will be answered via email. You can find some excellent resources available to you in the related content box. To learn more and register for upcoming webinars in our series, click the Take Action button. This session will be recorded and a link will be sent to you for on-demand viewing.
Well, welcome everyone. It's great to have you a part of this webinar today. My name is Mark Burgess. I'm a Senior Vice President of Market Strategy for Nextgen Healthcare. And I'm fortunate to be joined today by Aaron Gleave and Alex McIntosh, both from KLAS Research. For those of you that are not familiar with KLAS, KLAS has been in the market for well over 25 years. They specialize in data analytics, research, insights, specifically into healthcare IT. So we're fortunate to have them here with us today. We've done quite a bit of work with KLAS over the years to help us gain better insights into the market, into our clients, into our client needs. And we thought that this was a really interesting time to conduct this webinar. KLAS recently released a report on comprehensive ambulatory EHRs. A really compelling report. We found a lot of value in it, and we thought it would be great to have Aaron and Alex on for a little bit of a deep dive, give everybody a sense of what the report is about, some of the things that they can expect to see, good reasons to go to their website and download it. So let me welcome Aaron and Alex and say, thank you for being here today.
Thanks, Mark. Really glad to be here with you.
Bet.
Thanks for the opportunity.
Yeah, for sure. So guys, let me just start with a couple of basic questions, and then we'll let you get into a little summary of the report. So this notion of measuring, how well an EHR sort of spans in a comprehensive way across a wide swath of solutions. Give us a little bit of detail behind that. Like what inspired you to do this? Kind of how do you view it, and how should those that are reading it sort of take it? And maybe just a quick follow-on question that you can add there is just, is there any particular market forces and factors at play that you think is really driving this question out in the healthcare IT world?
Sure. No, glad to talk about that, Mark. I think it kind of starts with an underlying premise that everyone probably realizes now. Healthcare is complicated. It's a lot more moving pieces than it was 10 years ago. Those that have been in the ambulatory space for 10 years, you can go back and look at how simple it was with a PM and an EHR, and that's where it all started. And that's kind of where this trend began too, right? Where, 1.0 was getting your PM and your EHR from the same vendor. And we watched that trend develop and evolve and become something that providers wanted. They wanted that integration between those two core pieces. Now, all of a sudden, you fast forward 10 years and we've got all kinds of pieces now. I mean, we've got outreach, we've got intake, billing services, hosting services, patient engagement platforms, all kinds of stuff that's going on. And Alex and I, just as we watch this story unfold over the years, we just kind of wonder, is this going to continue to be a best of breed play where, ambulatory providers go to 5, 6 different vendors, or is this going to consolidate? And at KLAS, as you may know, we watch the patient voice, or the provider voice, and that provider voice has continued to speak, wanting consolidation, wanting more of that single place to go, right? I want to deal with one vendor. I'm kind of tired of the headaches of I've got to juggle 4 or 5 different vendor relationships, and how do I get them to play nice with each other? How do we get them to get along? How do I get them to partner with me towards actual outcomes if they're not incentivized to necessarily do that? They just are incentivized to just deliver a single product. Whereas if I could get my core vendor to partner with me on all these other pieces, then we're talking about providing solutions to problems, actual problems, instead of just delivering software. So we watch that provider voice, and it has distinctly been evolving in this direction towards how do I get a comprehensive solution? How do I get everything together? And talking about the benefits and deficiencies of not having that. So, Alex, anything to add?
I would say it's definitely increased over the past few years. I've done dozens of research calls and interviews with different provider organizations across the country, different sizes, different specialties. And this theme here on the slide, looking for a vendor that has all the bells and whistles, or they refer to it as one-stop shop, one hand to hold. This theme of looking for a simplification of their IT stack has been increasing, and has until last year actually, when it really I really noticed it very strongly in the industry with the number of interviews that I did with providers coming directly to us asking us, hey KLAS, who can I turn to that can fill all my IT needs? Where do I need to start looking? Is this something that other ambulatory providers are doing, or am I just kind of up in the night? Am I the only person that's thinking this way? But uh, like I shared with you earlier, and I shared with them, this is definitely a theme that's been increasing in the market, and I'm hearing more and more about it almost on a daily basis.
Thanks.
That's great. I appreciate the insights there. Kind of sets the stage, I think, Aaron, to jump into the, the summary, maybe start to give us some insights into what you and Alex were thinking when you were going through the setup here, the things that you're measuring, the insights that you're seeing. So tell us a little bit about that.
Yeah, so we pulled this chart from the report, Mark, just because it's so helpful in illustrating what we were trying to get at with this study. And what's so amazing about this is you look along the top and you can see just the sheer number of different module pieces that KLAS actually measures separately. We have we have actual categories for most of these that are standalone by themselves, right? Where there's third-party best-of-breed vendors that we measure in these categories. And now in this report, we're actually validating the use and adoption by providers from their core EMR vendor. And that's just so telling about this trend and where it's headed and where it's going. But a little bit of background for this chart is helpful. When in terms of methodology, KLAS went out and invited these participating vendors to provide their best foot forward customers. So what we're looking at is not a random sampling, but this is in fact a best case scenario, what is possible for each vendor. And we did that intentionally. We wanted to see what's possible because this is such a new and emerging trend. And we wanted to understand who's ahead, who is there, who is checking the boxes, delivering breadth. And that's the other piece of this chart that's important, Mark, is understanding that this is, especially the column with the stars, that is a satisfaction with portfolio breadth, meaning how many of these different pieces are provided by each of these vendors, and what is the satisfaction by the customers with that breadth. And what's so telling is to see that this chart shows that you've got vendors that their customers are not 100% satisfied. And I think that speaks to the demand, right, Mark? I mean, if they didn't care, they could easily say 5 stars, it's, we go to best of breed, but clearly providers are wanting more from their core vendor in a comprehensive solution.
Yeah, no, I when I saw this view the first time, this is really what grabbed my attention right out of the gate. As you said, Aaron, KLAS, has individual reports that measure all of these different solution verticals quite well, but rarely, I think, and maybe ever, have you plotted those all on one one chart. So really good insights. Great to be able to see this in one page, particularly for someone, you know, that is really sitting here saying, okay, how do I match stuff up? And that's always the question right out of the gate, right? How do things, you know, match up? It's highly informative, and I think it gives people an opportunity to really pinpoint some of the key questions that they want to ask on the front end of any of these discussions.
Right. There's a flip side of this chart too, Mark, that's interesting. And we, in the report, we combined this view with the other chart. And this just simply shows validated areas where customers are still using a third party. And this was interesting, right? Because we wanted to identify what are the biggest gaps. And this is going to vary by vendor, right? Like every vendor kind of approaches this differently, but categorically, what's really interesting is virtual care. And Alex kind of helped us lead our research into that area particularly. Alex, what findings around virtual care stood out as kind of that single category of the biggest gap?
Yeah, so we found, obviously, you can see here, there's a gap, or providers that we spoke with were using a third party for virtual care more than any other area of functionality. And what we found is a lot of these providers, when the pandemic hit, they adopted technology from their EMR vendors. And because it was quick, it was simple, they already had the relationship there. But as things have begun to normalize a little bit more, providers are often choosing what's easy, or what's easier for them. So we've talked with them, and they're using, for example, other vendors, freeware, you know, from Doxyme, or from they're using FaceTime, they're using Zoom, they're using whatever is easiest for the providers and what's available. We're also doing another study here that should be released, I think it's early next year, or early 2022, where we look at these EMR based virtual care solutions and ask them, you know, if you've moved away from your EHR vendor, do you have plans to move back? And some early findings from that show that, yeah, there are plans that these providers have to move back to their EMR vendor, to keep everything under one roof and to keep the technology stack as simple as possible.
Right.
Yeah, you know, guys, when I looked at this, you know, it really reminded me of, you know, how things changed so quickly during the pandemic, and virtual care became essentially overnight. It became, you know, table stakes, and we were fortunate that you know, we were able to have an integrated virtual care solution, and that, you know, kind of speaks to the fact that when you think about comprehensive and like sort of the cornerstones of what you really need to have to do that in a way that's meaningful, you know, you have to have strong integration with all the solutions that you're have inside your portfolio. And then, of course, you need an outward view of that as well, right? How you build your ability to share data out in the community. But kind of sticking with the integrated portfolio capability, you know, we were fortunate to be able to make some very quick modifications, really make sure that the workflows were ticking and tying the way they should, and be able to release that out to our client base, you know, rather quickly, you know, really in time for, you know, when they needed it. And so it kind of speaks to your point of, you know, hey, if you're already doing an integrated, you know, portfolio type process and methodology, your ability to make these changes, you know, faster maybe, and get, you know, information or get capability out to the client base, you know, is really improved, right? You can accelerate that faster. You can get speed to value faster. And that's, I think, you know, along the lines of what clients are demanding these days.
Right. And I would add, Mark, just that I think our data on the virtual care piece in general validates that, you know, vendors, Nextgen being one with a couple others, that had a pre-existing established virtual care platform. There's a distinct advantage that we see in the data with the customer experience, having that, like you said, time to delivery, rapidness of adoption, and an ability to roll that out quickly. So I think we saw that in our data as well. A couple other quick perspectives just to share here, Mark, on the idea of this one-stop shop. And each one of these comes from a different provider, and depending on their role, they kind of highlight different areas of either efficiency gains, more improved workflows and ways that they can see tangible outcomes within their organization having a platform like this. And that's it's very telling as we just continue to collect and see these types of comments coming up. We know that it's real, that this is a movement, that this is happening. You ready to shift gears a little bit, Mark, and talk about integration?
Yeah, for sure. Yeah, let's talk about integration.
Not too much of a drastic departure from what we've been talking about, right? But it's probably worth touching on just briefly about, the fundamentally underneath the idea of a one-stop shop is that each of these pieces are natively integrated, right? And that integration adds so much to smoothing out workflows and creating efficiency. And so a couple, again, points that we wanted to share, again, straight from the provider's voice. I'll just read this one. Some benefits that were promised were better efficiency, system integrity, and chart organization. All of those things were met with no problem. They didn't lose any staff. I didn't replace people by any means. People's functions changed a little, but the system just made our workflows cleaner. And we can actually take care of more patients with the same number of people. And this sentiment, Mark, this is at the heart of what's driving this, right? Ambulatory practices now, they are looking for greater efficiencies. How do we do more with the same amount of people, right? That's a huge trend. How can they do that? And so this type of sentiment, I think, represents a lot of the type of things that Alex and I have seen over the past couple of years. Alex, anything you want to add on efficiencies or these types of provider voices?
Yeah, with the provider voice, what was interesting about this study is this was much more conversational than a lot of the studies that KLAS does. If you're familiar with other studies that KLAS do, we go through a standard list of questions where we ask them to rate on a numerical scale, their satisfaction with different areas. With this study, we actually had very deep, they were very robust conversations with these providers where they shared with us their full experience in going with a comprehensive solution, kind of what led them to consider going with a comprehensive solution, and what the results were of going with that solution. And obviously, increased efficiency comes up time and time again. Additionally, many providers talk about increases in revenue that they've been able to see just by having everything in one place, in one integrated solution. They've been able to get their clean claims rate up, decrease their AR days, and just generally be more financially healthy than they were before they went with a comprehensive solution.
That's really good insights, and I was, I'll just offer up. I think that when you when you think about, and this is a bit of a question for both of you, organizations, healthcare organizations, particularly medical practices, ambulatory practices, they're really ramping what I will call their transformation. All organizations are transforming in some way, form, or fashion as the healthcare IT or healthcare landscape, continues to evolve. And that might be because they're addressing, alternative payment models in a way. They may be, creating a more comprehensive integrated care approach or just a care model change. Most, sort of driven off of different payment models, or they're trying to be more competitive, right? There's lots and lots of new organizations delivering care in the U.S. today. So physician practices, I think, are recognizing like, hey, I need to continue to up my game and make my business stronger. This idea of having a very efficient practice means that your ability to, operate in a high efficiency way, right, relative to all of the systems that you have working for you, allows you to be that much more nimble, right, as you go through that transformation versus trying to do, hey, I want to, do all of that at one time. That can be, even more challenging. So are you both sort of continuing to see that narrative? Alex, you mentioned the fact that this was a much more conversational report. So I'm curious some of the sort of anecdotal conversations or examples that organizations might have given, kind of relative to why it's important that I am, even more efficient than I've ever been before.
Yeah, beyond just the scopes of this report, a trend that we've seen in the market over the past little bit is, they are having to fight for patients. Like you said, there's more of a commercialization of healthcare going on with CVS threatening to get into the game with Walmart and with other large competitors. So they do have to do more with less. And by having this integrated solution, this single platform, the providers we spoke with have definitely seen results. They're able to be more efficient. They're able to drive additional revenue and able to feel a little bit more confident going into the future with having that single hand to hold. Aaron, anything you'd like to add?
Great.
No, I think that about sums it up. I mean, our two questions were efficiency and revenue impact on both those areas, and we definitely saw quite a bit of data that supported those outcomes. Last piece, Mark, that we've got is the patient experience, right? This is another big data point that surfaces in these conversations that we're having with providers, where this is increasingly a part of what providers are expecting now, right? Being able to have patient engagement tools, whether that extends into, some population health, that extends into outreach, patient intake, letting the patients engage over, within their experience is super interesting. And this is one voice that we thought represents a whole multitude of voices that we've measured. But talking again about efficiency, because everybody knows exactly what everybody else is doing. The nurse has the whole patient record. It's part of the doctor's care team. When a patient is called, they talk with the nurse they know. And then the patient can see all the things in the portal, which is another piece of this platform, right? Patients have to go to only one portal. It is unbelievable how much simpler, more convenient, and more efficient being on one platform is. And so this sentiment is bringing in the idea that not only does this simplify workflow for the provider office and that group and the team and the staff, but then looping in the patient, interacting with patients, engaging with patients, that part is made so much simpler. It's more convenient, and it just smoothly integrates into the practice workflow as well. And so this patient experience thing is super critical. This is one chart we pulled in from another report that kind of just shows how big a deal these patient engagement pieces are. And if you look at this list, Mark, what's so interesting here is that you've got PM, EMR vendors mixed in with all these specialty patient engagement vendors. So the fact that they're, vendors like Nextgen are at kind of almost the top of this list for number of capabilities that they're able to validate right alongside, vendors like Luma Health or Relation. That's super interesting, right? That's just so telling that EMR vendors are needing to step up and address this area and make it part of the comprehensive model, because it is that important. Alex, you did some work with Adam on our side. Anything you want to add to this?
No, I'd just say the patient experience is key. It came up in so many of these conversations. Just in terms of just improving their marketability within their own communities, having that high level of or high satisfaction patient experience is key. Aaron, just going back to that quote that you shared earlier with the patient portals, I know from my own personal experience with my primary care physician, I have to use, I think, 3 different patient portals depending on what I'm doing. And to simplify that process means a lot to the patient and to their satisfaction with the care that they receive.
Yeah, this is great, and we hear it as well, right? All of our organizations are instituting some form of a patient engagement strategy, and I think they all are focused on the fact that patients do have more choices than ever before. There are new entrants coming in that are providing services, and the level of expectation of the patient, which I think most now refer to as the consumer, is certainly on the rise. And so simplifying it, to your point, right, creating something that is, call it frictionless, right, lowering all of the complexity, even into the simple fact that, healthcare is a very complex industry. The ability to communicate with someone about their health conditions and all the things that go along with, privacy, security, making sure they're seeing the right information at the right time. All of those things all have to, get aligned, right? And so this idea of having a comprehensive solution to do that, and more importantly, in the approach, right? Like how you built your organization to ensure that, that intersection point happens at the right time. That all starts to show up when you've got someone who, is going through a health crisis or a health situation, and they need information, or they're trying to get access, or whatever their need is. Simplifying that is I think at the top of everyone's list. So I appreciate you highlighting it here. And again, I think just seeing these insights really helps individuals that are out looking for, okay, how am I going to make an investment today to really show up in a better way and improve the overall experience for my patients into the future and sustain it. So couldn't agree more. Great topics. Really appreciate the report that you put together. I suspect you could just remind everyone that maybe wants to gain access to the report, how they do that, just so that anyone viewing this or listening to it, has those details.
Sure. Yeah, happy to do that. Thanks, Mark. So for providers, provider organizations, KLAS welcomes you. Come to our website, KLASresearch.com. Sign in as a provider with your provider email, and we'll be delighted to get you access to that report. You can actually request a download on the site. We'll probably reach out and look to connect with you directly for an interview, or have you share your experiences with your vendors and what you're seeing, and that's how we continue to collect that patient voice perspective. But in return, we'd love to give you access to this report and others that might help you as you're making decisions like this in terms of what's best for your organization, consolidating your platform. So yeah, love to have you get on the site and come see us.
Well, Aaron, Alex, thank you for your time. Thanks for all your hard work, your good work. I'm sure there's going to be, lots and lots of interest in this report and others. So thank you for everyone that tuned in today and joined us. We really appreciate it, and we hope that you have found this valuable.
Thank you very much to Aaron Gleave, Alex McIntosh, and Mark Burgess for the insightful discussion. Thank you to our audience for your time. And for more information, email me at aavila@nextgen.com.